Good morning, everybody, and welcome to the first ever OneNeurology European Summit. My name is Donna Walsh, and I'm Executive Director at EFNA, the European Federation of Neurological Associations, and I'll be the moderator for the event today. Now, before I hand over to Professor Claudio Bassetti, who is President at the European Academy of Neurology and who will take us through the first part of today's meeting, I'd like to just give you a few housekeeping tips and tricks in this new Conference Plus platform. Now, as participants, you will all be muted automatically. We can't see you. Your cameras are turned off, so you don't need to worry if you need to get up to answer the door. But you can communicate with us using the chat function, which you will find on the right-hand side of your screen. So if you've got comments, questions, feedback that you would like to send through to us over the course of the next 3 hours, please do use that chat function. At the top of your screen, you'll also see a selection of tabs. You are now, I would hope, in the live stream tab, and you can see us coming live to you this morning. But you'll also be able to access there a more detailed agenda, lots of information on our high-level speakers that we have assembled for today's summit, and you'll also be able to take a look at the partners and supporters of the OneNeurology initiative under which this conference is being organised today. So with that, I am going to hand the floor straight over to Professor Claudio Bassetti. I hope you're all sitting comfortably, and we look forward to taking you through today's agenda. So Claudio, I'll hand over to you.
Thank you, Donna. Honorable State Secretary Dr. Frank Vindišar, Ministry of Health, Slovenia, distinguished members of the European Parliament and European Commission, speakers from the World Health Organization, invited guests. My name is Claudio Bassetti, and as you have heard, I am the President of the European Academy of Neurology. It is my great pleasure to welcome you also to this OneNeurology First European Summit. I hope that today's presentation and discussion set us on a common path to addressing neurological disorders. Your participation is therefore very much appreciated. OneNeurology is an initiative co-founded by the European Federation of Neurological Association and the European Academy of Neurology. It strives to make neurology a global public health priority. There are more than 400 neurological disorders. However, it is important to remember that connected to the central and peripheral nervous system, neurological disorders are one disease family. They have common risk factors, common determinants, common symptoms, and common disabilities, as well as posing cross-cutting challenges for those living with neurological disorders, their caregivers, our health system, and wider society. Regardless of the exact diagnosis, neurological disorders can lead to stigma, isolation, and discrimination. Patients may struggle to obtain an early, accurate diagnosis. There are challenges across Europe in ensuring equitable access to treatment, services, and support, exacerbated by major shortage in the neurological workforce. We need to do and learn more in the areas of prevention and promotion of brain health, and we need more funding for neuroscience. And yet, for too long, we have looked at only a handful of these diseases on an individual basis, rather than take an integrated approach to neurology across the life course and within our healthcare system, leaving no one behind. In today's program, I have the important task of presenting shortly the global and European burden of neurological disorders, evidence which clearly shows that the need to prioritize neurology and drive change at the governance, healthcare, and public research level. Now, if I could have my slides, I would illustrate what we know today. The next one, please. Next slide, please. Now, as I mentioned, 400 neurological disorders, and worldwide, these are very recent data. Neurological disorders represent the first cause of disability and the number 2 cause of death. Next slide. Now, again, based on recent data that have been produced also by the European Academy of Neurology, my predecessor, Professor Deutschel, you see the unexpected, I should say, prevalence of neurological disorders, which we have learned to estimate to be around 1 out of 3 of us in a lifetime perspective. But in fact, the most recent data suggest an even higher prevalence, which come up to maybe 50% worldwide and the WHO-defined European region. Now, what has been shown in the paper published by Feigin, this is a worldwide approach. In the past 30 years, we have seen an absolute increase in number of deaths and disability. This is related in parts also to the aging population. The next slide. Now, let's go a little bit more into the details. If you look now at the disability adjusted life years, abbreviated with the term daily, you see that on an overall perspective, neurological disorders account for 13% of the entire disability in our population. And if you look now at the European Union or at the WHO-defined European area, you see that cancer, cardiovascular diseases, and number 3, neurological disorders are the leading cause of dailies. The next slide, please. Now, if you look now at the second way of looking at burden, death, neurological disorders account in Europe for 19% of the entire mortality. And if you look now at the two different European populations, you see that we are number 3 after cardiovascular diseases and cancer. Now, which disorders are actually the driving factors in determining the burden? We have different diseases depending on where. If you look at a worldwide perspective, then we see stroke, dementia, and meningitis as very important drivers. If you look again at Europe, it is then a stroke, dementia, headache. The next slide. Now, it is important to say, and this has been a very detailed analysis at European level, that there are within even the regions of the world and even in Europe, major differences. If you look here at this cake representation of the specific frequency of stroke, dementia, and headache in the different regions of Europe, whether you look at Western or Eastern Europe, you see that there are major differences. These reflect genetic factors, social and economic factors, and other factors that we may not understand yet. And the variability is quite high, as you see, for stroke going from 28 up to 62%. Dementia and headache also may be less variable across the different areas of Europe. The next slide, please. Now, there are data on the available neurological workforce. This is a chapter in itself. This is just a simple representation of the number of neurologists in the different countries and how much patients do these neurologists have to take care of. And you see a huge variability, which, by the way, is seen also in other regions of the world, in the United States. And as you know, in Africa, there are even countries with 0 neurologists available. And maybe somewhat surprising, some areas are well served in terms of the number of neurologists, Georgia, and you see the other countries, Latvia, Slovakia, and then you have other countries such as Ireland, Albania, Cyprus, United Kingdom, where we do have a very low number of neurologists, which who actually then explain the high variability. And you see that the 85,000 neurologists in Europe have to take care of the 900 million citizens across Europe. The next slide, please. Now, about the cost, there are several analyses that look at disease-specific data. I bring one recent estimation of the cost related to sleep disorders, and you see that these are horrendous numbers. If you look at the gross domestic product at different countries around the world, Canada, United Kingdom, Japan, United States. In Europe, we have the last very large global estimation of the cost dates to 10 years ago. At that time, there was an estimation of 800 billions. But I'm happy to say that the EN has started a study to assess the economic burden of neurological disorders in Europe. And we hope to be able to present first data already in June 2022. And this is obviously very important data to support our cause and make it also supported by valid recent data. The next slide. Now, as you know, COVID-19 has increased the burden of neurological disorders. Professor Moro in the next session will present more data on this initiative, which has started in Europe and turned out to be actually probably the most precise assessment on the frequency and the profile of neurological impairments related to the COVID infection. We have this so-called energy effort across, in fact, Europe, but also many other countries in Asia, Latin America, and Africa. We have included over 2,000 patients, and we are, already following up patients, and we have already 1,000 that reached the first 3 months of follow-up. Professor Moro will tell you more about the data and how the neurological complications affect the lives of the patients with COVID. The next slide. Now, COVID-19 obviously did not only affect the patients, but also the neurological services, and we have many data. I will not go into details. These are just two of them, which show the the disruption that has been caused by COVID in neurology, in the neurological service. And this is related to travel restrictions, related to the lockdown and regulatory closure of services, neurologists being redirected to other services within the hospitals. And this led obviously to a collateral damage for neurological patients that had even less neurological workforce taking care of neurological diseases. And then you see then the significant impact on neurological research and educational activities, again, a collateral damage related to the COVID infection. And and also the problem that patient organizations were not often involved in the decision taken by the national governments. The next slide. Now, we start having good data on the drivers of the burden. As I've shown you, more is to be done. I have mentioned aging. I did not have time to go into gender differences, which are very important. I alluded very briefly to socioeconomic factors. You have seen the differences from Europe, within Europe, and with other regions of the world. I mentioned very briefly the shortage of neurological workforces and services also related to the COVID pandemic. This was obviously a European-centered analysis, and we have just very briefly alluded to the fact that there are many other drivers of the burden, which relates to the increasing cardiometabolic burden of risk factors, but we have also sleep loss, sleep disorders, environmental factors, including infections, meningitis, COVID. But more is to be done to really understand which are the drivers and what can we do also to prevent the burden of neurological disorders, the topic of brain health, which is something we would like to come back to you in the near future. I believe this is my last slide, and I hope, distinguished speaker, that I could give you a glimpse in what we know and also what we do not know about the burden of neurological disorders in Europe and worldwide. And I also welcome your commitment for Europe to work together to tackle these challenges. Now, I would like now to hand over to the Honorable State Secretary, Dr. Frank Vindišar, Ministry of Health of Slovenia, for his keynote address.
Yes, thank you. Dear distinguished guests, today's event, the OneNeurology EU Summit, organized in cooperation with OneNeurology Partnership, is intended to accelerate efforts to establish a European Health Union. It is crucial to work together to address key common EU health challenges in a more coordinated and effective way. In this way, the EU also gives priority to neurological diseases. They are the third most common cause of death in the EU and are identified in the EU for Health program as one of the priority areas of non-communicable diseases. It is expected for the World Health Organization to adopt a global action plan for neurological diseases in 2022. EU countries in general supported the preparation of the plan. Today's event is important as it will discuss how the EU can best prepare for the implementation of the Neurological Diseases Action Plan in a coordinated way and in line with the EU for Health program, with a view to improving neurological health and care for a third of the EU population affected. It will as well identify the best ways to effectively implement the World Health Organization Global Plan of Action for Neurological Diseases in Europe. As the summit brings together global and European experts in neurology, as well representatives of World Health Organization, the European Parliament and the Commission, member states, doctors, researchers, the non-communicable diseases community, patient groups, and civil society, it is a tool to bring solution to the European citizens. I wish you a fruitful discussion and thank you from Ljubljana.
Thank you very much, Your Honorable Minister, for this important keynote address. I know that time is short, and I would like now to introduce, and it is my honor, the next keynote speaker, Dr. Dolores Montserra, member of the European Parliament and former Health Minister of Spain. Dolores, the floor is yours.
Thank you very much to all of you, and thanks to the Slovenian presidency of the Council of the European Union, the European Federation of Neurological Associations, and the European Academy of Neurology for having me here today to contribute calling on neurological disorders as a public health priority in Europe. Europe is leading the global fight against climate change and care for the planet. And now, in the wake of the pandemic, in health innovation. We want to lead the health innovation all around the world, not just in Europe. So the health and socioeconomic crisis generated by the pandemic has put all sectors under tremendous pressure, while representing an unprecedented opportunity to improve the organization and management of national and cross-border health. Thanks to the European Union strategy of COVID-19 vaccines, we have achieved in 1 year what used to take a generation, or perhaps more than one generation. Moreover, in record time, we have erected the pillars of an important building, the next European Union for Health. That inside of the European Union for Health, we have important tools. We put the first important tools like the COVID-19 vaccination strategy, the strengthening of the ECDC and the EMA, the creation of ERA and its incubator, the new European Union Health Program, the European Beating Cancer Plan, and the new European Pharmaceutical Strategy. That all together will inaugurate what will be the European decade of public health, innovation, and research. I had the privilege to be the rapporteur for the Parliament of the just approved new pharmaceutical strategy. And neurodegenerative disease have been highlighted by the strategy among the unmet medical needs in Europe that need to be urgently and effectively addressed before they evolve in a new silent pandemic risk. So the strategy, first priority, is to put patients in the center of all the health policies and of the health care process. Access to the best and most innovative treatments for all the patients is one of the first objectives of this new European pharmaceutical strategy, and is the most relevant challenge we have to face. So effective disease control requires innovation. There is no innovation without access. We need to broad and speed innovation access to tackle disease without a known cure and significant unmet needs. This is of a particular relevance of neurology. The speed, the unprecedented progress that we have made in neuroscience in the last few decades, we need to do much. A report published earlier this year shows that only 23% of the disease burden for neurological conditions can be averted by 2040 by scaling up existing treatments. The WHO Global Action Plan on Epilepsy and Other Neurological Disorders 2022 to 2031 set its first target on 75% of countries adopting or updating existing national policies, strategy, plans, or frameworks to include neurological disorders. In the area of cancer, for example, all European countries have second or third generation national cancer plans. Or for example, 22 European countries had diabetes national plans as reported by the European Joint Action CRODIS in 2016. Against this backdrop, until now, no European member state has a national neurological or brain health plan. So we need to change this. Our new first autonomous and more powerful European Union for Health program lists for the first time neurological disorders among priorities areas in the field of non-communicable disease. It is a small, huge step. It will provide ample and timely opportunities to help member states with devising and adopting those national strategies. This type of European Union cooperation already proved its added value in other therapeutic areas. Moreover, the European Commission is planning to launch a policy implementation roadmap for non-communicable disease, which will also cover neurological disorders. This is a great news, which confirms that neurology has finally received the deserved attention in the framework of the non-communicable disease. We need for more alignment between global, European Union, and national priorities and plans implementation. As the COVID-19 pandemic clearly showed us, one country alone will never be able to face and succeed against a global health threat. So neurological disease and mental illness are a fast-growing global health threat we need to stop as soon and as effectively as possible. So today's event represents a stone step in the process of joining forces, counting on the possible tools we can foster and planning for an ambitious path ahead. So the European Union action can make the difference, I'm sure. So thank you very much to be here with you, and I'm so sure that together we can do more for all the neurological disease.
Thank you, MEP Dolores Montserra. I know that you have to leave soon to catch your flight, but I would really like to thank you for this passionate, if I may say, and very important statement you made. I would like to thank the Honorable State Secretary, Dr. Windishar, and you for your participation, and we will come back to you for some discussion shortly. But for today, it leaves me to just thank you for these important statements. Now, it is my pleasure and also honor to welcome and introduce Dr. Tarun Dua, who is the head of the Brain Health Unit. She has the task to present the WHO 10-year intersectoral global action plan, for which all 27 EU member states showed support. Tarun, the floor is yours.
Thank you, Claudio, and my pleasure to present today the Global Action Plan. I have a set of slides, so if you would please give me a minute, I'm going to share my screen. Claudio, let me know if you can see the screen show.
Perfect.
Great. So thanks for setting the scene so well.
and by also the honorable speakers before me, who emphasized the importance of neurological disorders and how the intersectoral global action plan can be the facilitator and the catalyst for further action in Europe. I wanted to remind ourselves that within why this global action plan is important, that it fits in within the WHO's mandate of the triple billion goals, which is about universal health coverage, that 1 billion more people are receiving it, 1 billion more people are better protected from health emergencies. And I think this is important for the area of brain health and neurological disorders, as we have seen due to COVID-19 pandemic, that there are neurological consequences, as well as the concern that we have because of the post-COVID-19 condition. 1 billion more people enjoy better health and well-being. And the speaker before me, Dolores, she emphasized the importance of prevention of neurological disorders. So as WHO, we take a three-pronged strategy. One is stepping up leadership across global, regional, and national level. Two, strengthening normative work, for example, in terms of technical products or global public health goods. And third, being driving impact in the country. And I think this is the actions are, as I said, across all three WHO levels. And thus, this action plan makes big sense to have it today. Now, some of you will be familiar, but some others will be asking, why so much of noise around a global action plan? What does it really mean? So briefly, that it is a global action plan is something that is mandated by the World Health Assembly. That is, the countries, they ask for it. And they ask the WHO Director General to develop it. It recognizes that the issue is a public health priority and that policy change is needed to address this issue. And therefore, it is an indication of the commitment at global, regional, and national levels. So what it includes is vision, some kind of strategic framework, also in terms of how it should be implemented. So the mechanisms for implementation, coordination, responsibilities, and indicators and targets. Because we know if we do not monitor what is being done, things may not happen. I'm not going to go into the statistics that why such an action plan is needed, because Claudio, in his opening presentation, very well summarized the burden that is due to neurological disorders. I will only make one point here, and which is at the bottom part of my slide in terms of the burden, which is across all the countries. In fact, majority of burden, more than 75% of the burden due to neurological disorders is in low and middle income countries. And therefore, a global action is required. And in terms of if we think as Europe, action is required across all countries in Europe. And the second mandate for the action plan is because not only there is high burden, there are limited resources and there is a high treatment gap. Access to services and support is limited. Very few people will receive a diagnosis. And so if you do not receive a diagnosis, nothing can be done. So for example, only 1 in 10 people with dementia receive a diagnosis in low and middle income countries. We are all aware of cost-effective treatments for epilepsy. In fact, if we look at some of the medications, the cost can be as low as $5 per person per year. But the treatment gap is 75% in low-income countries. That is only 1 in 4 people with epilepsy receives the treatment. And same is true, or in fact worse, for many other neurological conditions. There is non-availability of these essential cost-effective medications in primary healthcare system. There is shortage of workforce, and even if available, the distribution is uneven. So, for example, if we have, neurological workforce, the number, let's say it's 7 per 100,000 in high-income countries, it is only 1 per million in low-income countries. In addition, there is many of the neurological disorders are associated with stigmatization and discrimination. This lack of knowledge, lack of awareness and understanding about these conditions. So, as you heard earlier, that the World Health Assembly 73 requested the WHO's Director General to submit to the 150th Executive Board the 10-year intersectoral global action plan on epilepsy and other neurological disorders draft. We are very thankful to the contributions that have been provided by member states, as well as many of the non-state actors who are on the call today. Briefly, the process that has been followed, I'm not going to go into the detail, but just to say that the process has included consultations at various steps with both member states as well as non-state actors, first on the discussion paper and then on the first draft. I also wanted to emphasize the consultation that happened with the patients and their families, which is extremely important because it is the people that the action plan is that they should be at the center of such an action plan. I already mentioned about the presentation to the 150th session of the Executive Board in January 2022, and hopefully the consideration in the 75th World Health Assembly. I talked about the importance of people and their families, and this is just a word cloud based on the comments that we have received from persons with neurological disorders and their carers. So if you can see some of the important messaging that has been that we received, the comments that we received is that this is really important, that the people, they talked about the importance of stigma that is associated. They talked about how an integrated approach is required, some of the preventable causes such as sports injuries and so forth. I'm not going to go into the detail of the action plan, but just a couple of points that I would like to make on the content of the action plan. Firstly, on the vision is aspirational. It brings together the concept of brain health, which is that it is valued, promoted, and protected across the life course, and that neurological disorders are prevented, diagnosed, and treated, and premature mortality and morbidity are avoided, and that people who are affected by neurological disorders and their carers attain the highest possible level of health with equal rights, opportunities, respect, and autonomy. And thus, the goal is about reducing the stigma, impact, and the burden, and improving the quality of life. The action plan is grounded through 6 guiding principles. 1, the primary health care and universal health coverage. 2nd, integrated approach to care across the life course, and we're going to come to it a little later. Evidence-informed policy and practice, intersectoral action, empowerment and involvement of persons with neurological disorders and their carers, gender equity, and human rights. There are 5 strategic objectives, and each of the strategic objectives has action areas. So the 5 and as well as there are targets and indicators to go with each of the strategic objectives. The first strategic objective on prioritization or governance has 3 action areas, 1 on advocacy, 2nd on policy plans and legislation, 3rd on financing. The 2nd on diagnosis, treatment, and care, which looks at issues such as care pathways to medicines, to health workers' capacity, but also at carer support. Promotion and prevention, looking at the various risk factors and determinants such as infections, head spinal trauma, healthy behaviors, environmental risks, but also zeroing down on the importance of brain development in children and adolescents. The importance of research, innovation, and information systems. I think this is an area that needs much more global attention than currently happening through investment in research. In terms of it, we need better data and information systems. The action plan calls for taking a public health approach to epilepsy, and so therefore there are 3 action areas on access to services, engagement, and support for people with epilepsy, and epilepsy as an entry point. Having discussed the action plan, I just wanted to take a couple of minutes to say that it is not that we would be starting the work on neurological disorders from WHO. Quite a bit has already been happening on the ground. So be it in the area of policy, advocacy, development, for example, we already have a global action plan on public health response to dementia. Be it in the area of service delivery, for example, there is a big program on reducing the epilepsy treatment gap. Issues such as neurodevelopments, issues such as intellectual developmental disorders, autism spectrum disorders, work in the area of neurology and COVID-19, as well as some others such as Parkinson's disease. So what the action plan will be doing is building upon the work that WHO has already been carrying out. And that requires taking an integrated approach. The integration is because there are many neurological disorders. We already heard that. Integration is because we need to have a spectrum and a continuum from promotion, prevention to rehabilitation. Integration in NCDs with mental health, with communicable diseases, looking at social determinants. Integration because they happen across the life course, and integration because it is not only the health sector but social care system as well as other sectors that needs to be involved. And therefore, the way forward to that integration is that we need many sectors to work together. There need to be some national mechanisms. We need to prioritize activities for promotion, prevention. It needs to be part of the agenda in terms of the budgeting. Stakeholders needs to be engaged. And we need to tailor the message for different audience. A case for investment needs to be made. But and most importantly, we need to empower and involve people with neurological conditions and their carers. Thank you very much for your attention. Thank you very much for your support to WHO. We look forward to enhancing partnership and collaboration. And I hand it back to Claudio.
Many thanks, Tarun, for this very nice, very clear presentation on how the initiative started, but also then the contents, but also the frame in which this has been developing. I have maybe the pleasure of starting a discussion. I would like to ask the attenders to also use the chat function to ask questions. So, I mean, you mentioned national mechanisms. So what do you think the member states could do to utilize the momentum linked with the WHO gap? So what could be this mechanism? You alluded to, but maybe you can expand a little bit on what the nations could do first, to.
Thank you, Claudio. I think the action plan provides an opportunity to each of the countries to look at maybe doing a landscaping or a situation analysis. Because the action plan is global in scope, I think it needs to be contextualized and adapted. And the first part about the prioritization and governance would be to say, okay, what kind of the relevant action plans or policies exist in countries, and what is the way of integrating neurology into those action plan, or there is really a need for a separate neurological or brain health policy in the country. I mean, countries can decide to take one or the other route. And the second, and this requires bringing different stakeholders across the table. So we need to have, the policymakers together with professional experts But and as I said, we need to hear from people living with neurological disorders and their families that how they would like to see a national response to happen. So I would say that these would be the first steps the countries can take towards the implementation of the action plan.
Thank you. I see there are several questions. I don't know, Tarun, if you see the questions or do you want me to read them? Well, there is the question about the other contributors. I mean, the list is very long. I like to stress the fact that we neglect sleep, as you know. I mentioned this. You want to say something? Maybe it's also the question of epilepsy that was raised. I mean, it's in the title. I think this is historical. You want to make a short comment on the other contributors? The list is obviously very long.
So thank you, Claudio. So I talked about that the action plan is global and we need to contextualize and adapt to the countries. And, and one of the steps after you have, in terms of looking at the national policy landscape, the stakeholders, would be to actually look at the burden of different conditions and which should be the priorities. So which conditions are important? So that is one. Having said that, we know that many of these neurological disorders, they require a similar approach. So, for example, if we think in terms of the cross-cutting issues, such as building the health workforce capacity, if the primary healthcare workforce is trained, they will not only take care of issues such as stroke or epilepsy, but also for many of the other neurological disorders. If we looking at the access to essential medicines, sorry. This can be looked for many of those neurological disorders. So I think a prioritization exercise will need to be made by countries, but also looking at that integrated approach will actually help in reducing the burden due to many neurological disorders. Same is true if we look at the issues such as stigma and discrimination. There could be, for example, a public awareness campaign that can be mounted against neurological disorders in general. And therefore, I want to actually take this opportunity to congratulate the One Neurology initiative because it is giving us a model, an exemplar that how such an approach can be taken. So this is extremely important. There is, a question this is about is that how do we reach people with epilepsy in rural district area in developing countries? And clearly, this is what the action plan is all about in terms of that how we can reach the 75% of people who are living in low and middle income countries, and this it clearly requires national commitment. This requires a multi-pronged approach, a systems approach. For example, improving access to medications, reducing stigma, building up the capacity of primary healthcare workforce, and we need to bring all of these together to help, to provide the care, have an outreach so that the care can be provided to people who live. So it's not about that people should be traveling to these specialist hospitals. I know, Claudio, I can go on and on, but
no, I know.
I give the floor back to you.
A comment from Ireland, and in fact, this applies to what you have just said. And so I mean, we do have this completely, how shall I say, a different situation. If even in Europe, you have seen the data in Georgia versus Ireland. But I mentioned that in Africa, you have countries with 0 neurologists. So this is where the integrated program, so you want to say something about, this approach, because it is really a challenge. I mean, some countries are well served with multiple specialists, but the One Neurology initiative is really to say, well, we have one brain, one life. So, I mean, we have to take care of, and we don't have all these specialists everywhere. So any other thoughts about how this could be integrated? I mean, we have the patient, we have the neurologist, but we have also other professionals that should contribute. Any thoughts about that?
Definitely, Claudio. If you remember the slides, I talked about the inequity in the workforce. If we look at the numbers such as 7 per 100,000 in high-income countries and 1 per million in low-income countries, there is a huge mismatch. And one of the things, I mean, I haven't presented that data, but even if we start training more neurologists, for example, in Africa, where there is currently 0 or 1 or 2 or 4, there is never going to be sufficient number of neurologists in the next 10 years. I'm talking about the duration of the action plan. So can neurological care should only be provided by specialists? It is not a feasible way. It needs to be part of the primary health care. So many countries, for example, are now working on the universal health coverage benefit packages. So we need to ensure that neurological disorders are included in such a benefit package. And I think that the health workforce such as community health workers, primary care doctors, nurses. In Africa, many countries we have cadres such as clinical officers. They need to be trained. And this is where I feel that there is a role of professional societies in terms of building up the capacity of these primary health care providers across various parts of the world.
I see many questions. Maybe I ask one. So when is the second draft of the plan going to be seen? I mean, we have seen the timeline. So any updates on that second draft?
So it should be available shortly on WHO's website. And as I mentioned, this will be discussed in end of January 2022 by the executive board. So keep an eye on the WHO's executive board website for the plan to become available.
I read the questions. I have one also that I noted. How does the WHO view the formal inclusion of neurology as one of the major NCD in Europe? So how do you see this? I mean, we have multiple challenges. This is an additional one, maybe be also an opportunity. I think one of the speakers before us alluded to this. Can you just elaborate shortly on this?
I think from a global perspective, it is great that neurological disorders are included as one of the challenges or as part of the NCD programs. I think this provides us an opportunity. One that we need to continue advocating for better services, better care for people with neurological disorders and their families. 2, that an action plan can remain only on the paper. And so this provides us an opportunity that in Europe it is being recognized as an important priority that actions are implemented. And 3, that as I talked earlier, it's about not that we need to have a standalone policy or a plan for neurological disorders. There can be many entry points. NCDs are one, mental health is another one. It also needs to be integrated with communicable diseases. So I think we take any entry point, any action, and build upon that.
I like the comment because we should also realize that we tend to think in silos, but in fact, things are connected. You alluded to mental and brain health. I mean, if you think about COVID, we still do not know how to differentiate what is really neurological damage, what are mental or psychiatric consequences, and the two are sometimes indistinguishable. I see another question which actually relates to one slide. And I actually share this approach. I mean, we do have also the opportunity of preventing neurological disorder. I'm thinking also at less advantaged countries about stroke and many. So, I mean, you alluded, and we are in discussion about brain health. So what is the WHO doing with brain health? I mean, you're producing a paper, and the EN has the pleasure to contribute. Can you just say in few words what is planned in the next, let's say, 1-2 years? This is a specific question saying that we should not concentrate only on diagnosis and treatment, but
Thank you, Claudio, and thanks. I haven't seen the comment, so I don't know who raised this.
Sabina Brennan. Yeah.
Sabina, thank you, Sabina. This is extremely important question. I think it's we more and more there is recognition of the importance of brain health, and so as Claudio mentioned, we would be coming out with a position paper on conceptualizing what is brain health, what can be done, and where are the research gaps, and what is the direction for the for the policymakers, what is the direction for the action that can be taken today. So this is this is a complementary product to the action plan. The importance of brain health is recognized because, as I mentioned in the vision statement, the first part of the vision statement is that the brain health is valued and promoted across and protected across the life course. So I think this is enshrined within the action plan. And I quickly went through those slides, but we have one of the strategic objectives, which is about promotion and prevention. So clearly, I think and I could not agree more that we require this kind of an integrated approach where we have policies and actions for tackling treatment and care issues, but also that how brain health can be promoted and how neurological disorders are prevented. Yeah. And this requires actually working much more. The prevention requires working much more with other sectors, such as in terms of environmental risks. I see a comment related to Parkinson's disease. So clearly, there is that intersectoral action that is extremely important.
Yeah, maybe I make a short comment. I mean, there are multiple definitions of brain health. The EN likes really very much the WHO because it has a lifelong approach, and it's not only disease-centered. And, we speak a lot in neurology about stroke and dementia. We have seen the burden, but we should have an overall, and actually, we could even think even a prenatal, this has been known to be a risk factor for. I think we have a last question that I think it's very interesting by Richelle. What about the use of digital health to improve access? It's a very interesting question, particularly if you think about the big countries and less well served. What is the WHO position on that?
Clearly, digital health is the way to go. And we have I think COVID-19 has provided us the opportunity as a kind of a real life example of the need to invest in digital health, but doing it with quality. And I would again say doing it, understanding the perspectives of people and their families, that how such a care should be sustained and to be scaled. So this has to be part of any ongoing strategy that we think about improving access to services and care.
Thank you, Tarun, for this discussion answers. I see many more questions, but I think we have to stick to the timetable. On behalf of the One Neurology Partnership, I thank you and the previous speakers for these very good contributions, very interactive and informative discussion. Thank you. And there is now a short break, and I would like to invite you all to join in again at 11:10. And sorry if we could not address all the questions, but we will take note and try to get back to you offline. Thank you, and see you at 10 after 11.
In the age of 47, I was on a business trip in a foreign country, and during the night I got the stroke. I didn't realize that, and I tried to get out of the bed in the morning, but I was already paralyzed. So I fell out of the bed and tried to get some help for rescue. But then I lost consciousness, and when I woke up after 4 weeks unconsciousness. I thought, okay, I have some problems and I will train a little and then I will be fit again. I didn't realize really that my arm wasn't existing. I couldn't walk. I was ignoring the situation, and I thought I'm very soon fit, and I never had an idea about going such long to therapies and treatments. I would really be happy when the system would be able to support the patients with the necessary and the relevant therapies afterwards to get their rehabilitation, because this is a lifelong process and it costs so much money and so much energy from the patient side as well. And but it's really so important to give these people the quality of their life they had probably before, and to relieve the suffering of themselves and their family members. I think the knowledge about stroke is very poor in the citizens. Very rare they are thinking that the center of their individual organization in the head is affected, and this is a brain disease, and all the functions they have are probably affected if they will have a stroke. The knowledge is very, very poor, and it should be more education. There should be more education for stroke symptoms, risk factors, and rehabilitation processes, etc.
Welcome back, everybody. That was Manuela Mesmer-Wulin there, speaking of her experience of life after stroke. And as we heard in the earlier presentation, stroke is the major driver of the prevalence and burden of neurological disorders. And I think what Manuela has really convinced us of is the need to act now. And that is what this next panel is all about. And it's my pleasure to welcome 5 esteemed panelists to join me for the next 30 minutes discussion. We have Katie Dane, who is the Chief Executive Officer at the Non-Communicable Disease Alliance. We have Professor Wolfgang Grishold, who is the President-elect at the World Federation of Neurology. Also joining me is Professor Elena Morrow, who is the chair of the COVID-19 task force at the European Academy of Neurology. And we have another Elena, Dr. Elena Becker-Barroso, who is the editor-in-chief at Lancet Neurology. And last but not least, we have Russell Patton, who is representing those living with neurological disorders on our panel today. And Russell is the Secretary General at the European Parkinson's Disease Association, as well as a board member at EFNA. So thank you for joining me, everybody. I'm going to jump straight into the discussion because we've a lot to get through. We've only got 30 minutes, and I'm going to come to you first, Elena Becker-Barroso. As editor-in-chief of Lancet Neurology, I guess, you know, your job is to publish the latest evidence around the burden of neurological disorders. Now, we've heard a lot of numbers in the earlier part of today's meeting. Could you maybe sort of recap some of those facts and figures for us, and also maybe add in any additional evidence that you feel we might have missed? We don't hear you, Elena.
I hope that you can hear me now.
Yes, go ahead.
Perfect. So yes, we have published several articles showing that neurological disorders are actually the leading cause of disability worldwide, and the second leading cause of mortality worldwide, as Professor Bassetti has summarized very beautifully earlier on this morning. Understanding the burden of neurological disease has been technically quite complicated, even though in retrospect it might look a little simpler. And this has been done by the Global Burden of Disease study led at the Institute of Health Metrics and Evaluation in Seattle. And they are monitoring these epidemiological measures worldwide in a consistent manner. And this is tremendously important because that means that we now have data that are comparable across regions and countries. So if we could set some targets to diminish burden, then the evaluation of those targets can be done homogeneously and rigorously, right? So I will invite anyone in the audience to actually come to the Lancet website and check all these many articles of the Global Burden of Disease study investigators. They are on open access and available for free. So they will see all the nitty-gritty and the many details of this very complicated epidemiological investigation. Otherwise, all these data are very nicely accessible in a data visualization tool that the IHME have at their website, where they have all the burden of diseases categorized by age and by sex for more than 200 countries and territories. So regarding neurological disease, again, I really want this to sink through, because this is obviously a huge and amazing take-home message. Neurological disorders are the leading cause of disability worldwide. The leading cause of disability worldwide. So obviously this is the main reason, I suppose, why we are here gathering today. Now, if we focus on Europe, as Professor Bassetti mentioned this morning, neurological disorders in 2017 were the third most common source of disability after cardiovascular disease and cancer. However, we do know, we have other evidence, for instance, here in the United Kingdom, showing very clearly that the cost for health services of neurological disorders are much more than those of heart disease and cancer combined. Okay, so the burden that neurological disorders put on the national health systems is absolutely overwhelming. So yeah, this is tremendously overwhelming evidence, and so I will invite anyone to have a look and check up the data. Of course, things will change from place to place, from region to region. The data differ also according to age. So obviously the burden is not the same for the prevalence and incidence and disability in children with neurological disorders, in adolescents with autism, for instance. But obviously the main reason to be worried about the situation in Europe because of the aging of the population regards to those 70 years old and older, where the burden of Alzheimer's disease and other dementias and stroke is actually, well, I think it's quite worrisome, quite worrisome, yes.
Thank you, Elena. And maybe when we're finished talking, you could put the link in the chat to those statistics you mentioned that we could share with our participants as well, because there's so much data out there. I think people will spend days and hours mining that and looking at that sort of breakdown, as you've just said. But before I move on to our next speaker, just a quick comment from you. You said yourself, you know, it's overwhelming. The statistics are overwhelming. And this is often the response we get when we go to policymakers and we talk about prevalence and we talk about cost and we talk about impact on those affected. And the question we get back is, well, it's so big. What can we actually do about it and where do we start? Have you published any data in Lancet that is looking more, I guess, at the solutions that we should be trying to pursue in this space?
Well, I'm glad to say that, yes, that the solutions are available and they need to be implemented as soon as possible, obviously. So the theme of the necessary workforce has been mentioned already, so I'm going to skip that, but obviously that's tremendously important. We need a larger and well-trained workforce. including neurological nurses, obviously neurologists as well, and rehabilitation services. But in my view, what is mostly needed right now in Europe is a serious investment in neurological researchers, right? But that said, yeah, the focus should be on prevention strategies at the moment. And we do know that primary prevention is feasible, and primary prevention can actually make a substantial difference in the short, medium term, while research goes on and will allow us to do some secondary prevention and improve treatment of all these diseases. What I didn't mention before is that apart from the evidence on the burden of disease, the GBD study is also supplying us with a lot of information on modifiable risk factors for all these diseases. And there are very good news at that respect. So for instance, in the case of a stroke, we do know that about 90% of the burden of stroke could be prevented by tackling some risk factors that are modifiable, which means that obviously we can act on them, saying, weight, lifestyle factors. The same for Alzheimer's disease, actually, not as much, because about 40% of cases of Alzheimer's disease could be prevented by tackling 12 modifiable risk factors. So obviously this is big news, I think, and this is information for which we could act upon immediately. And I think in my view, that's actually a very optimistic message to share with people, because there is a lot that we can do now. Then, of course, as I said, as we do all these interventions population-wide for primary prevention, we should invest and push for clinical research and neuroscience research. I think that the European Union, to promote this health innovation that Dolores Montserra mentioned earlier on, really needs to make a huge effort on neurological research. Otherwise, we will be well behind the United States, who are actually making a very, very substantial investment in this field.
Thank you, Elena. And we'll be talking to representatives from the European Commission later on in today's event, from both the Research Directorate and also the Public Health Directorate, so we can put some of these questions to them. And obviously, we'll be talking to Katie in a couple of minutes around things like prevention, promotion, modifiable risk factors, and how neurology can align with efforts in those spaces in other non-communicable diseases. But I want to turn now to Professor Wolfgang Griswold, because Wolfgang, we've spoken a lot about neurological disorders, but I want to think a little bit now about neurology as a discipline, as a concept. Could you maybe elaborate on the importance of neurology as a field?
Thank you, Donna, and congratulations to this excellent talk and to these excellent exchanges. And many of the ideas that I would like to mention have been mentioned before. But I think one point is very important: act now. And I think this is what patients and what carers want to hear most and need to hear most. So if I go to neurology, we assume that the name is attributed to Thomas Willis in the 17th century, and the field takes care of the nervous system, which is the brain, the spinal cord, the nerve roots, muscle, the autonomic system, in regard to function, in regard to dysfunction, in regard to therapy, in regard to rehabilitation, and of course also at the end of life and palliative care issues for these patients. Just to mention a few prominent diseases which have been mentioned already, which is stroke, Parkinson's disease, MS, epilepsy for the central nervous system. Trauma has been mentioned in regard to spinal cord injury. And of course, don't forget the large number of people with diabetes who suffer from diabetic neuropathy. Neurology has developed in most countries from psychiatry and internal medicine. And I think one of the strong assets of neurology is and will be that it's a strongly multidisciplinary and multi-professional field that tries to interact with most other fields and needs to interact. It is based on neuroscience, and it's multi-professional in regard to its effect in regard to rehabilitation and into regard to long-term care. But I think one of the most important messages that we can make is that neurology had the name to be the exquisite diagnostic field and was unable to do any therapies. This has changed for different reasons. In stroke, it has changed not only because of the intervention, but also because of logistics and organization. In genetic diseases, it's in pinpoint and molecular and genetic considerations. The World Federation of Neurology, who has presently 123 members in 6 regions, has highest imaginable standards of neurology in some member states, and in other countries, unimaginable poor standards. And this has been mentioned by Darun before. And we are trying to organize we are working on a needs index that is based on a social demographic index, which gives an idea on several factors how rich or how powerful a country is. And from our members, we can say preliminary, we have 17 members who are lowest middle income. And in these countries, it would be 1 neurologist for 2.8 million people. Just to imagine that. So this is not only a point of neurology and healthcare, this is also a point of budgets, of per capita income, and what is done. And I think what I've learned in my years in the World Federation, we also have to be careful not to impose a category fallacy in what we think is correct in medicine. As an example, I would say that there was a nice analysis about headache in Africa, and it seems only 20% of patients with headache see medicine, what we call medicine, and the rest goes to healers. So also this is something important. And what I also think we have learned from our environmental studies is that not everything is modifiable. In low-income countries, people often have house burns and fire in the house that you cannot modify. You cannot modify your lifestyle if you're in pressure to earn just a little money to live. So these are important things in addition to age, which we have to take care of. The second thing, I think, only two things. Health illiteracy, we think, happens somewhere else, but this doesn't. This also happens in Europe, and I think to make aware of hypertension is one thing, but it's maybe the only great thing that has worked so far. And of course, advocacy. And nobody knows what advocacy means, literally to speak for someone, but this is a large advocacy meeting bringing about the importance of neurology in Europe. And I don't think that Europe is privileged because it has health systems and it has large access, but it's not completely privileged because there are issues like I've mentioned before. Thank you.
Thank you, Professor Griswold. And apologies, I believe that there may have been a loss of sound on the front end for some of you, but Professor Griswold was mentioning that we need to really raise awareness of neurological disorders to really ensure that policymakers and decision makers see this as a distinct discipline and not as a set of disparate diseases, particularly as we move forward with the Global Action Plan and other initiatives. So I hope you're all hearing me now, and I'm going to move on to our next panelist, who is Katie Dane. And as I said at the start, Katie, you're coming from the Geneva-based International Non-Communicable Disease Alliance. We've heard, Katie, throughout this morning's session that neurological disorders are the leading cause of disability worldwide. We know that if we don't address neurological disorders, then we're never going to reach targets around non-communicable diseases that have been set out in policy priorities like the Sustainable Development Goals, for example. But what I wanted to ask you is, how do you think we can best balance a focus on the kind of disease-specific element that we have within the neurology field and align that with work that's going on maybe on broader, cross-cutting, synergistic topics in the wider non-communicable disease space?
Thanks, Donna, and it's a pleasure to be with you today. So, I mean, I think in summary, we always need to have a combination of the two, disease-specific focus plus the broader NCD approach that we've seen really, growing momentum over the last decade or so. And the reason why is because some governments with more resources are able to really take up, act on, and invest in disease-specific strategies and guidance. And obviously, there's a whole range of different guidance developed by WHO, as well as technical packages around different parts of diseases of the NCD agenda. And I think it's particularly important for neurology because it has really kind of fallen through the cracks in a way of the NCD agenda and then the mental health agenda in a way. And I think it's fantastic that obviously mental and neurological health conditions were kind of included finally as one of the big NCDs in 2018 when governments met in New York for that high-level meeting. But I think the real beauty of the broader NCD approach, and I'm obviously biased coming from the NCD Alliance, and that's the whole reason why we were set up in 2009, is it enables joint action around the common barriers and the common solutions that bring all of these different diseases together. And I think in terms of the common solutions that we're all working on, I think, as you mentioned earlier, the real glue around our diseases is the prevention side of things. It's, by action around the shared modifiable risk factors of tobacco, alcohol, physical activity, and unhealthy diets, we can really prevent these diseases developing, and obviously avoid preventable and avoidable mortality. And as was mentioned previously, it's the same for what's good for your heart in terms of keeping active, eating well, and engaging in social activities are also good for brain health. So it's really a win-win. And I think kind of joint action around those modifiable risk factors on the prevention side of things is critical. But there's obviously also really important common solutions on the health system side of things. Obviously, others have really highlighted the importance of a focus on the health workforce. And that cuts across all the different NCDs that we're seeing in terms of lack of human resources around diabetes, neurology, cardiovascular disease, particularly in low middle income countries, as well as other challenges around access to essential medicines and technologies for people living with NCDs. And as the previous speaker just highlighted, I think the other kind of glue that brings us together at the NCD level is this challenge around financing. NCD still remains the kind of least funded global health priority. Less than 2% of $22 billion of development assistance for health is allocated to these issues. And it tends to be patients, people living with these diseases, that are having to bear the brunt of the costs. It's out-of-pocket payments, which are really the common way that the NCDs are paid for. So there's obviously a lot that brings this broader the broader agenda together, and I think it makes a lot of sense at the advocacy level to be joining forces and to be working together.
Absolutely, Katie. And later on, we'll be talking to representatives from DG Sante at the European Commission about a new policy implementation roadmap for NCDs and the fact that there will be action proposals in there specifically on neurological disorders, which is a major step forward. And that brings me to my next question, which is around how we can ensure that action in a region like Europe is aligned to activities at the global level. So you're representing an international group. You've probably seen lots of global action plans being released from the World Health Organization in the past on different disease areas. Do you think that those types of global action plans really can be leveraged to push for concrete change on the ground in countries, in regions like Europe, for example?
I think yes, in short, but with caveats. I think we've seen that WHO global action plans on different issues. I mean, the global NCD action plan on NCDs, for example, that was developed in 2013, has been a really important kind of normative instrument and guidance that's really shaped regional and country responses since then. And I think there's kind of three main ways that it can help shape regional and country level. I think it helps shape regional and country level at the political level by putting these issues on the map at the global level, and raising the priority of the issue, essentially. I mean, just this year, for example, WHO launched a global diabetes compact around the centenary of the discovery of insulin. And that has really helped put diabetes back up on the global agenda, and that translates down to national and regional levels. And similarly, with the WHO Global Cervical Cancer Elimination Strategy that was launched last year in 2020, it's had a similar ripple effect politically, regionally and at the country level. At the technical level, I think these global action plans provide a really important framework, because take the NCD action plan, as I mentioned earlier, since 2013, we've seen real progress in countries and regions then developing their own national and regional NCD frameworks and action plans, and they tend to draw from the global normative approach that WHO has developed. So now we've got nearly 3/4 of countries that have national NCD action plans that draw from the global framework. And then I think the final part that's important for global to regional is that these global action plans provide an element of accountability, because what's important in the action plans is that you have specific time-bound targets that all governments are held accountable to. And again, that has a really important ripple effect to regional. But I would just kind of build upon the previous speaker, Wolfgang's point about the importance of advocacy. I mean, we can not easily, but we can get national and regional and global action plans developed. But the real, devil is in the detail in terms of the implementation of those action plans and the resources and the funding that's available. So advocacy is absolutely critical in making sure that they don't just sit on the shelf, as it were, and that they're really, truly translated into action and implementation.
Thank you, Katie. And that brings me nicely to you, Professor Elena Morrow, because one of the, I suppose, key priorities on the global health agenda at this moment in time is COVID-19. And we thought maybe it was starting to go away, but it's back with a bang. And I think it's obviously going to occupy the thoughts of policymakers and decision makers around the world, and particularly here in Europe, for the weeks and months ahead. What I wanted to ask you, given your role as chair of the COVID-19 task force at EAN, is whether you felt, as well as the challenges that COVID presented for those living with neurological disorders and those caring for them, have we learned anything from that in terms of how we can maybe do neurology better moving forward? We're not hearing you, Elena. So we've no sound. Whilst we're waiting for you, Elena, to reconnect, I'll jump onto you, Russell, and we'll see if we can sort out the technical issue there, because you've been sitting here waiting patiently. You're the voice, no pressure, of people living with neurological disorders on this panel. And I wondered, from what you've heard so far, is there anything you want to add into that conversation around why we need to act now?
Yes, thank you, Donna. And obviously, thank you very much for inviting me and the European Parkinson's Disease Association. I guess I'm going to talk a little bit like a patient. We see things a bit differently. On the one hand, I think what the WHO have done is absolutely fantastic. It's a miracle what they're doing. But we don't see that miracle in Europe yet. And when you make the title, Why the Time to Act Now, I would challenge that title and say, we are so very late. I'm going to use a word which is horrible. It's a pandemic. I think we have on our hands a neurological pandemic. We have a Parkinson's pandemic. And decision makers, I believe, are aware of it, but it's Pandora's box. It's that box they don't want to open. I fully understand why. It's a dangerous box to open. But I think if we do not put pressure through advocacy, this Pandora box will blow in our face. It will be a volcano. It will be a hurricane. We all know that these diseases, 400 of them, if not more, are on the rise. If I take Parkinson's, it is frightening. I have done a survey of decision makers in Europe. Most of them didn't realize that it was a disease that middle-aged people, let alone young people, let alone children, can get. Everybody gets Parkinson's, and it's on the rise. Is it to do with pesticides? Is it to do with older people? But then it wouldn't answer why so many young people are getting it. But what we see is a pandemic in the making. And this is not Russell Patton, as Director General of the EPD, saying it, is many neurosurgeons, HCPs who are seeing it on a day-to-day. I think the role to do something is very much a shared problem. And I would say is I have a 7-action plan in terms of what we should be doing. First and foremost, again, thank you to the WHO, WHA to open up this global action plan. I think it's put neurology on the map. 4 years ago, neurology wasn't on the map. And I think somebody today said decision makers don't even know what neurology is. Now, that's equally our fault. So there's a massive education to do. But I think it's first about putting the patients and their carers at the heart of policy and decision making. It's getting there, slowly but surely, but I think the voice of the patient and the carer needs to be listened more. So thank you for inviting the patients today. It's not just a global or European or national or local issue. It's all 4 levels that have to work together. You can see the great work of the WHO, but if the EU doesn't do anything, nothing's really going to happen in Brussels, and I'll come back to that. I think it's about, in Europe, it's about the member states, the 27 countries that make up the European Union, who need to give powers to the EU to start to do things in health matters. Now, I'm going to say something not many people like, but if you look at the treaty powers of the European Union, per se, they don't have the right to deal with health. How is that possible in this day and age with COVID? And yet the EU has done some fantastic work around cancer, cardiovascular diseases, through the back door. And there are European parliamentarians sort of knocking on the Commission's door and say, let's do something. And if there is a silver lining to COVID, this is the time. Let's get the European Union to have treaty powers to be able to do health policies. But it's also for the EU, and this is where we can help them, to put pressure on the member states to have these powers. Because without treaty powers, the EU is not going to really be able to have the muscle, the money to really do something that will change things. And I think finally, it's a partnership. The EPDA totally supports the OneNeurology campaign partnership. We have to do it together with those 400 neurological diseases. It's also about educating HCPs. And I just thought I'd leave you with this final note. There are over 400 neurological diseases, and yet there is only 1 neurologist for 10,000 patients. How many neurologists do you think across Europe have real Parkinson's disease expertise? They're not even in the hundreds. That's what's scary. So on that note, I would just say, again, thank you for inviting the EPDA. And the voice of the patients is, do things now, we're late. And if you don't, that burden of disease, those 2 words that resonate very well with decision makers because it's about money, it's time to act now. Thank you.
Thank you, Russell. And that would have been a lovely way to end this panel discussion, but we're going to zoom back over to Professor Elena Morrow. I think, Elena, I've heard you coughing. Are you with us?
Okay, I was trying to.
Yes, I got the message. So back to you, back to COVID. Tell us what you think. Have we learned anything from the pandemic?
So sorry, and thank you very much, Donna, for this invitation and for organizing everything. Well, I think a lot of been said even before, a lot of is being written. I think what we have learned as neurologists and also as patients with neurological disorders and caregivers of patients with neurological disorders is a lot. I start with the neurologist. I think that what has been done, the neurologist has been part of the global picture of COVID since the beginning, when we realized first that this virus has a lot of neurological manifestations. And second, the neurologists were also involved in the general care of the COVID patients, because all the neurological wards were disappear, and the neurologists were involved in pneumological issues and also in neurointensive care facilities to help our colleagues to deal with this infection. So I think that the neurology has been very flexible and very helpful to the community, the health community, to face this new virus that we didn't know how to deal with. And I think this is something important. Then I want to say that also the scientific community has been particularly useful. I think that I have to praise and to say thank you to the Neurological, to the Lancet Neurologists, because they've been quite receptive in putting together all the neurologists, the neuroscientists, in join forces together. We have the WHO Neuro Coalition. We have the Neurointensive Care Association, we have the European Academy of Neurology, the American Academy of Neurology. Everybody try to put forces together to understand a little better why this virus has neurological manifestation, how can we eventually treat better these patients, because usually the neurological manifestation, they make COVID much worse, and then the new chapter, the long COVID, and the vaccine reaction to with the neurological manifestation. And the journals, I have to stress that, because there's been a big effort. Most of the journals, neurological journals, they gave open access, free access to all the COVID papers, and which I think help us quite a lot in getting the knowledge, increasing the knowledge, and try to fight better these diseases. I want to stress also the effort that has been done to collect data, the registry that we mentioned. These are very important, because we can work on big data, on understanding from the whole community. We talk about prevention, but we talk about also how to better deal with the consequences that we are facing, and with all these waves. We really need it. We needed to learn quickly from this area, and I want to touch the patients. So we work together with a paper trying to listen to what the patients have suffered, what they think that we have to change in the future in patients with the neurological diseases. And what I think I can get from the paper that we published together is the lack of communication that they felt it was important to receive during the first wave most of the time, and the sensation to feel a bit abandoned. We talk about telemedicine, which help us a lot to reach them. But I think this is in the future what we need to understand more, how to deal with this, and to understand that it is important that they feel that the community is helping also the patients who don't get COVID and they're alone in their house, and the caregivers. Who are important also for the physician, because they can be our hands in dealing with the patients. And the last thing, if you allow me, is the medical students and the residents in neurology. So they suffer for many reasons. And again, telemedicine and telelearning, e-learning help them. But these are things that we need to think carefully how can we implement in the future.
Thank you, Elena. And just in the last minute before we go to the break, You've outlined, I think, the challenges that have been faced by the different stakeholders in the neurology field during the pandemic. You've also touched upon maybe some of the learnings we've had that could help us as we sort of build back into the future. And if you talk to policymakers at a European level at the moment, there's a lot of buzzwords around, building forward better, future-proofing healthcare systems, pandemic preparedness, resiliency, sustainability. How do we put neurology into those discussions and at the center of those dialogues?
Well, if you're a stroke specialist, you say time is life, right? Because you have to intervene quickly to open the brain vessels and to restore the brain as much as you say. I will say that the brain is life. So if you don't take care about brain health issues, you really don't care about yourself and the society, because we say that health is a priority for everybody. And above all, brain health is becoming a priority for everybody. So we have to be very careful in planning health programs in Europe.
Thank you, Elena. So health is wealth and brain is life. And I think on that, it's a good wrap up to this panel discussion. Thank you so much. We could have spoken for so much longer, but some wonderful insights and actually a lot of questions and comments that I can bring to the next panel discussion after the break, when we are joined by representatives of WHO Europe, the European Commission, the European Parliament, and some of the OneNeurology partners to advance this discussion. So we're going to break here until 12. So you've got about 6 or 7 minutes to go grab a quick cup of coffee, and then I would encourage everybody to be back in their seats to listen to some of the esteemed speakers we've got coming up for the final part of the meeting. The other thing I just want to mention before everybody runs away is that I know some of you have been coming and going over the course of the morning. Some people who've registered have not been able to join. So this summit will be recorded and will be available in the platform after the event. So if you've missed anything or you're worried you'll miss something coming up, we will make sure that all of this content is sent to you after the meeting. So with that, I'm eating into your coffee break, but we've got 5 or 6 minutes to go get a quick drink, and we'll see you back there then.
Thank you.
A migraine headache is diagnosed, generally speaking, by the story told by the patient to the doctor. It's a one-sided headache with accompanying symptoms, and that can be sensitivity to light, noise, also to sound, of course, and the other symptoms include nausea, vomiting, in my own case, diarrhea, very sick tummy, and perhaps lasting from maybe 4 hours to 72 hours. The burden of migraine is really determined by the severity and the frequency of those symptoms. I have a brain disorder, a neurological disorder. It had affected my life, especially when I was a young mother. So if you could imagine a young mother with 3 small children lying on the floor of the bathroom, unable to move because in my case there's a risk of unconsciousness. It's basilar migraine. If you can imagine the children being terrified because mother has vomiting and diarrhea, and children are just so helpless. I felt so helpless. Getting the proper diagnosis, learning about my own migraine, joining what was then called the British Migraine Association was immensely helpful, because their newsletter coming through my letterbox let me believe and know that somebody understood, somebody cared. There was work going on out there on this neurological disorder that I had, and that something could be done about it. But of course the key thing is that I had to do something about it. And that's where the building up of the knowledge, the information, accurate, reliable information, reassurance, and the mutual support is so vital.
Thank you to Audrey Craven there, telling us about migraine, which is the most prevalent of all neurological disorders, but probably also one of the most misunderstood conditions. And I believe Audrey is with us in today's audience. So Audrey, thank you for allowing us to share your words during today's OneNeurology Summit. Now, before I get to the second panel discussion of today, it's my pleasure to introduce you to Dr. Natasha Azopardi-Muscat. Natasha is the Director of the Division for Country Health Policies and Systems within WHO Europe. So, Natasha, the floor is yours.
Thank you very much, Excellencies, colleagues, ladies and gentlemen, healthcare workers, patients. It's a real honor for me to join you today and to be able to share some of our insights on this important topic on behalf of the Regional Director, Dr. Hans Kluge, for the WHO Regional Office for Europe. And I would like to first of all thank the European Federation of Neurological Associations, the European Academy of Neurology, OneNeurology, and the Slovenian Presidency of the Council of the European Union for organizing this important conference. It really shows the foresight and awareness of the urgency to act on this health area. We know that neurological disorders are the leading cause of disability globally. And in Europe, neurological disorders rank third for both disability and mortality. And as you're all well aware, this has led the international public health community to better recognize neurological and mental health disorders as one of the top 5 NCDs. Admittedly, this hasn't always been the case. There was a time when, as we have just heard also from this video testimonial, neurological conditions were somewhat absent from the health policy agenda, somewhat hidden and overshadowed, not properly recognized. But thankfully, things are now changing and have changed. We are seeing the much needed leadership and commitment to ensure that no one is left behind. The World Health Organization has prioritized now neurological disorders, as shown by our decision to lead efforts under the 10-year intersectoral global action plan on epilepsy and other neurological disorders. This is an ambitious plan that brings together a wide range of participants. But whilst having a plan is an important and good start, it is equally important to support all stakeholders in implementing it through active and inclusive collaboration. This is because neurological disorders truly have an impact of everyone in society. They lead to increased costs for governments, communities, families, and individuals, and to loss in productivity for our economies. The burden of neurological conditions in the European region is high and is expected to increase due to the COVID situation, including because of a series of post-COVID conditions, which we are beginning to understand better now, including links between acute COVID cases and delayed neurological complications like stroke and cognitive impediments. The good news is that in the European region, neurological conditions in our region are becoming more visible, leading to better and targeted responses. And there is increasing awareness of the need to work across the continuum of care to ensure that our health systems have the right mechanisms in place to prevent, to ensure that diagnosis is timely and early, and also to prevent then complications and to support persons who do have complications arising from neurological conditions. At the EU level, for example, the European Brain Council has done important work putting neurology on the agenda, as well as the Rare Diseases Consortium. It is very clear that the neurology landscape in Europe is changing with a growing recognition of the burden of disease. At the WHO Regional Office for Europe, This is an area of work that we are taking very seriously. Our European programme of work, United Action for Better Health, which was adopted by all 53 ministries of health of our region in September 2021, is truly committed to leaving no one behind. And through this programme, which we call our EPW, we are working with governments and civil society to make sure that everyone, everywhere across the region, can get the care that they need. For neurology patients, this requires action on several fronts. And let me share with you some examples of what we are doing. First of all, we are really moving with the mental health agenda. And although the two areas don't necessarily overlap, our mental health work benefits from a wide range of supporters and networks, also thanks to our recently launched Pan-European Mental Health Coalition. This means that this is a forum where the needs and perspectives of neurology patients can receive the right exposure and attention. Second, we are moving with our rehabilitation agenda by strengthening rehabilitation services in countries' health systems. In this area, we are providing practical guidance for governments to strengthen rehabilitation policy and strategy, to strengthen the health workforce, and to provide the services that are needed. For example, we are working on a package of interventions for rehabilitation, which identifies 20 health conditions, including neurology, that will provide evidence-based guidance to countries on the package of care for rehabilitation services. And at the regional level, we are also developing a new framework for action to achieve the highest attainable standard of health for persons with disabilities. With an estimated 135 million people in the European region living with some form of disability, we will be working on a political resolution on disability and presenting this for adoption by the 72nd Regional Committee for Europe in September 2022. As part of this process, we are ensuring that there will be appropriate representation and input from EFNA to support us with the development of a resolution that really meets the needs of all people with disabilities, including those affected with neurological conditions. And finally, we're working on a new initiative intended to improve access to novel high-priced medicines. We know that sometimes the main obstacle to receiving proper care is the high cost of some of the novel medications needed to treat neurological conditions. And we're looking to change this. Last year, with the support of the Norwegian government, we launched a new initiative, the Oslo Medicines Initiative, which facilitates dialogue between the public and private sector, specifically between countries, industry, and patient organizations on this topic. Our ambitious aim is to reach a better understanding on how we can take actions to improve access to effective, novel, high-priced medicines across the European region for all those patients who can benefit. This has relevance for many patient groups, but including those with neurological disorders, where some of the new medicines prices hit new highs and where coverage becomes truly challenging for governments and public funders. This initiative has both a political and a technical stream, as the two are inseparable. The first is to involve governments in dialogue with other stakeholders to better understand and progress on the issues. And the second is to ensure informed discussion and debate around these key issues and practically work towards identifying potential policy solutions to be taken forward. Across the three areas of work which I have highlighted as examples, we at WHO Europe are working to ensure that neurology patients and the neurological field receives the attention it truly deserves in the public health space. It is very reassuring and encouraging to see that events of the kind that have been organized today are taking place. It means that we are all combining our efforts and working together to work towards achieving our common shared goals of better health outcomes for our people, including those with neurological conditions. Thank you very much for giving me this opportunity to share the work that we are doing in this field.
Thank you so much, Natasha. And actually, the three areas that you touched on around, post-COVID, looking at access to treatments, but also looking at access to care and rehabilitation, were topics that had come up in the chat throughout the meeting today as well before you began to speak. So you've read our minds in terms of some of the topics and themes that I feel the audience really wants to see addressed. And we'll certainly be back in touch with you after this meeting today to see how we can ensure that we can participate, support and align with all of the work that you've outlined in your presentation. I know you're tight for time, so we will let you go and we'll move on to our panel discussion, but we very much appreciate you being with us this morning.
Thank you.
So now let's move to our second panel discussion of today, and it's my pleasure to introduce our next set of panelists. We have John F. Ryan, who is the Acting Deputy Director at DG Santé. We have Barbara Kirstens, who is Head of Unit for Combating Diseases at DG Research and Innovation, also at the European Commission. We have MEP Katarina Konechna, who is an MEP that we have worked with ongoingly to position neurology as a public health priority within the Parliament, and we'll be talking to her about that in a second. And then we have some representatives of 3 European organisations who are part of the OneNeurology initiative and who will be giving us their perspective on what was discussed today and where we need to go next. And they are Professor Thomas Berger, who is Chair of the Scientific Committee at the European Academy of Neurology, Tadeusz Havrat, who is the Senior Advocacy Manager at EFNA, and Assistant Professor Corinne Katzmann-Berovets, who is representing the European Paediatric Neurology Society today. So thank you all for joining us. And John, I'm actually going to start with you because in the earlier part of today's meeting, we had some discussion around what we were calling a policy implementation roadmap for non-communicable diseases that was announced by the Commission. I believe you're now calling it the Healthier Together EU initiative on NCDs. But can you tell us a little bit more about this work? I know you had a meeting just this week with various stakeholders in the field, and any insights you have on how neurology will be included within that initiative would be very welcome.
Well, thank you very much for inviting me to speak today. We have heard earlier on the burden of neurological conditions, and we know that these form part of a group of non-communicable diseases, which represent 80% of the disease burden in the EU. Now, of course, all of the attention for the last 2 years has been on communicable diseases and on COVID, and that, of course, is still continuing, especially with this new variant, which is arriving on our doorsteps. But we decided that we should make an effort to scale up our efforts at the European Union level, very similar to the considerations that Natasha has just given from the World Health Organization, because we work in parallel and synergy, of course. And therefore, we decided to strengthen our activity on non-communicable diseases, including neurological disorders and mental health. And the concept was launched this week, in fact yesterday, with the EU member states and with stakeholder groups. We organized a discussion with our stakeholder community, and I'm happy to see that many of the associations represented today were online in that meeting yesterday. And I think we had 350 organizations in total, which gives you an idea of the level of interest. And basically the idea is to take the Sustainable Development Goals and the World Health Organization targets as given. In other words, we're not going to invent new targets, new indicators and so on. This will be an initiative focused on implementation. So we don't want reflection groups. We don't want to spend the coming years preparing white papers and green papers and blue papers. The idea is to go straight into it, because as many people have said, the time to act is now, and I think there is a consensus on a certain number of actions which need to be taken in different areas of non-communicable diseases. And just to give you a flavour of what we announced yesterday, we already have a Commission action plan on Europe Beating Cancer, which is one of our flagship initiatives, with a budget attached of 4 billion euros. So it's a fairly substantial piece of work. Even compared with the American moonshot on cancer, it's significantly larger. In fact, if you look at the financial firepower. So we're planning to do something similar in relation to non-communicable diseases, which would entail focusing on issues like data and information, because we know that there are a lot of gaps in our information on certain non-communicable diseases. Secondly, then looking at the prevention side, because of course we have a strong mandate and tradition of working together at the European Union level on prevention of non-communicable diseases. I won't repeat the usual line from OECD about the 3% of health budgets being spent on prevention, 97% being spent on care. I mean, those are figures from the WHO which are out there for years, and I don't think we're ever going to completely reverse that balance. But I do think we need to invest more in prevention and promotion, health promotion. The third aspect would be in relation to treatments, and we've seen that previous speakers have already spoken about the availability of treatments. So we have the EU pharmaceutical strategy, we have great resources being invested in development of new medicines, particularly through the research program, and I'm sure my colleague Barbara Kerstens will speak about that later on. And also supporting clinical trials, for example, and all of the work that's being done to reform the pharmaceutical approval system through the European Medicines Agency. I mean, these are just, I'm just touching on the subjects very briefly here. And then, of course, issues around patients and patient care. This is something we introduced in the cancer plan, which is quite new, but really issues like stigma, issues like how do you support care communities who are supporting patients in their daily life who may be outside the formal health system, but nevertheless are necessary for patients to keep going. And of course, all issues around survivorship and comorbidity, I would say as well, you know, because many of these things are linked. You were talking earlier on about stroke. So we will have, in fact, a stream of work on diabetes. We'll have a stream of work on cardiovascular, on neurological and mental health, and also on obesity. And these will be based on the same approach we're taking for the cancer plan. And 20% of the budget from the EU for Health programme, 20% of the budget has been reserved for best practice interventions. What we're trying to do is then have this sort of policy direction or policy steer for different diseases, which would, and health determinants, which would help us to spend that money and invest that money cleverly over the coming years. It doesn't happen very often that we have such an amount of money to invest in public health. And therefore we feel that rather than just putting the money on the table, it would be helpful to have a consensus with the member states and the NGOs and stakeholder communities and health professionals about where we should be investing. Thank you.
Thank you, John. And that's definitely music to our ears, because there was a lot of conversation earlier on before you joined the panel around, you know, having these policies and frameworks is one thing, but actually implementing them and having the finance to implement them is absolutely another thing. And it seems like that is all being taken into account in this plan, which I think is great. And Dolores Montserra at the start of this meeting, when she opened up, said this is the decade on the back of COVID for public health, for research and for innovation. And for us, it's hugely important that neurology is at the centre of that. And on that, I'm going to come to you, MEP Katarina Konechna, because you really have been a key part of our work in this sphere. It was last year where we worked with you and your team just to get the word neurology into the text of the EU for Health programme. And we feel if that hadn't have happened, what John has just outlined may not have happened yesterday either. So I wanted to get your perspective on, what you think of these latest developments and how maybe we can work with you and other MEPs in the European Parliament to really shape the direction that this travels.
So thank you very much. And the first, thank you very much for invitation to this great conference what you organized. So, and thank you for a question, because it's very, very important. Yeah, it's true that the neurological disorders are listed among the priorities of NCDs in the EU for Health program. Unfortunately, that's probably, sorry, John, but it's probably everything positive that I can say about the EU for Health and its current implementation so far. Due to its many priorities, the program is completely underfunded from the outset. The situation worsened after the introduction of the HERA framework. The European Commission, and if I give it a good information, and this information give me your Commissioner Kyriakides, if I have a good information, 55% of the total EU for Health budget for HERA operations, considering that another 30% of the budget is allocated to the Beating Cancer Plan, which what we agreed last week, and another 5 to 10% to development of EMA and ECDC agencies. One does not have to be a genius mathematical to find out that there is no money for other priorities in the program. I don't know where you take it, 20%. Yeah, please give us the better information. But if I really account, there is no money. And we tell you many times, because the HERA is something more. What are you preparing in the Commission? We not discuss this in a preparation of EU for Health program, and now doing us big and huge problem. And this is something where we need to be correctly, especially in this conference, especially because sitting here, the patients, the doctors, everybody who will work with it. It's impossible to tell the people we give you money if we haven't. Sorry, John, but it's a reality.
Do you want to respond, John, to that? Do we have the money? Is the money there?
What I said was that 20% of the budget is reserved for best practices and interventions, particularly for non-communicable diseases. This is something which is in the legal text, and I'll put the legal text in the chat so you can read it for yourselves. That's what I said. Thank you.
Thank you, John. Katerina, back to you.
I will hope, and I promise you, as a OneNeurological European Summit, and everybody who heard me, that it was before the HERA. But I promise you, because John tell us, that we will push it from the European Parliament, that European Commission give you this money. But John speaking about the situation before the HERA. HERA give it a big mess in all these programs. Yes, 55% for HERA. It's true or not, John? Sorry, but yeah, we are in a conference. But
I feel like my picture should be in the middle of the screen as a referee.
I want to only give you so huge money as it's possible, because it was our aim this year in consultation about the new EU for Health program, and this is why we're doing what we are doing. So that means that, yes, we are preparing to cooperate. We are preparing to support you. I'm very happy that we have in a legal text some argument how we could push it. But in the other side, we need to be very careful, because I'm afraid that HERA, the EU for Health program, is now in a new priorities, really underfunding. And we need to be very careful that everybody who expected that we give them the money, this money take it. in the next years. And this is what I could promise you from my side, from the side of the European Parliament and from my colleagues, because we have a very good and closely cooperation between the colleagues from another parties. It's not about the political view of the world. It's about how we can help you. And we're doing anything what is possible for this. Yeah, it's only reality where we are now. And yes, the Parliament does not agree now with this division, and not a word was said in the negotiation of the EU for Health program on HERA funding. Consequently, the Joint Committee of the European Health Emergency Preparedness and Response Authority is scheduled to take place late January, early February, which will then start the 2 months period set in the declaration for the budgetary scrutiny procedure. This is what we are doing because we heard that the HERA taken us huge money from the EU for Health program. And therefore, we in the European Parliament are still fighting for this money, but it will be difficult. I need to tell you that it's not easy. And however, we will not be able to do it alone. That's why we maybe have some exchange with John, is that we need your support as a patient organization, as a colleagues who support us from the Parliament side. Here we come to your original question, yeah, and we need your help in this fight for money, because now it's everything open, because we didn't see there some possibilities, what was in the beginning, and after HERA coming something else. But we need now your support, and please contact the Commission if you didn't see there your money. But promise you, it's only one word I can tell you.
Thank you, Katerina. And before I move on with the rest of the panel discussion, John, I do want to give you a chance if you want to comment again on that. And there's also a comment in the chat asking, is this 20% reserved or has it actually been allocated at this point? So it would be good maybe to get some clarifications there. And there's also a second question, John, that I'll put to you at the same time, which is whether this sort of new initiative that will include neurological disorders will take an integrated response to neurology, or if you'll be looking at maybe a number of specific diseases within that, and rare neurological disorders were mentioned in the chat.
Well, first of all, I'd like to thank Catalina for her support in the EU for Health programme and the strong support of her colleagues as well in the European Parliament. The second point I'd like to make is that when the Commission was proposing a new EU for Health programme, it was done on the basis of the COVID outbreak. In other words, I think it was recognised by the Council and by the Parliament that we needed a stronger investment in health. And one of the areas for a stronger investment in health was crisis preparedness and response. And therefore, this was the reason, the raison d'etre for the increase in the budget in the first place. So going from where we were, which was 350 million over 7 years, 350 million over 7 years, to the current funding of the EU for Health programme, which is vastly superior. But what I'm saying is the political decision was taken to increase the budget in the first place in order to respond to the huge deficits we've seen in COVID. The fact that some of this money has now ended up being spent on crisis preparedness and response is exactly what we had asked for. It's exactly what we planned. And the mention of HERA as a mechanism is shorthand, if you like, for crisis preparedness and response, because that's what HERA is doing. And this was always part of the plan. What I was talking about earlier on was the completely innovative approach of reserving 20% of the budget, whatever that budget is, reserving 20% of the budget in the legal text for health promotion and prevention. And that's why we're trying to have some sort of a steer with the member states and with the different disease communities, disease professionals and patient groups and the European Parliament. We're trying to have some sort of a steer on how we spend that money. The 20% is not the only money we're going to be spending on non-communicable diseases, because there will be money spent on, for example, pharmaceuticals, there will be money spent on digital health, there will be money spent on other topics which will feed in and support health systems and patient groups. but it is a substantial investment nevertheless. And I agree that putting the name HERA on it makes it appear as if it's disappearing from the budget. In fact, my point is that this was originally the reason why we were given the money, was to improve crisis preparedness and response. So for me, it's a logical thing. And by the way, the health program is not the only program contributing to health. The Resilience and Recovery Fund, which was launched, has already spent 50 billion euros on health-related projects, not to mention the money that's been spent by RTD, the research side. And as regards what we are planning to put into the new approach on neurological disorders and mental health, this is an open agenda. If you look at the minutes of the meeting, which I posted in the chat, where we launched this new initiative, it's a completely open book. We're looking for ideas here. So I'd encourage those online not to ask us for the answers, if you like, but to give us some of your contributions as to which direction we should be going in. Thank you again for giving me the floor. And I don't want to appear contradictory. I'm not contradicting anybody. I'm just trying to give the position from our perspective. Thank you again.
No, and it's good to have, I think, both sides, both perspectives here, because for us there was also an earlier discussion with the previous panel around the need actually also to position neurology very centrally in those debates around pandemic preparedness, crisis management, future-proofing, resiliency, so that some of that budget that is there as part of this new HERA authority could also be used to support activities that are of relevance to our community. So I think, Katerina, will definitely be back to you to strategize in terms of how we can work together on that one, and certainly John will be knocking on your door to ask for that 20% if we don't see it forthcoming. But I want to jump to you, Barbara Kirstens, at this point, because John has also mentioned that obviously DG Research and Innovation traditionally has been a major player in the neuroscience field. And from my side, I've always been a bit envious that there seems to be such a priority on neuroscience research, and we haven't seen that being replicated in the public health side of things. We're thrilled that this is changing, but my question to you, I guess, is how do you plan to really sort of align and reinforce those public health actions with your prioritization of neuroscience within DG Research?
Thank you, and thank you also for inviting me to speak at the OneNeurology European Summit. So as you know, and you were referring to, we invested quite a lot of money in the past years, about 725 million per year for funding for brain research. And if you look at Horizon 2020, it totaled up to 5 billion. But we need to do even more. And that is why under Horizon Europe, we will further prioritize brain research in general, which includes neurological and mental health. We know that we have made a lot of progress in the understanding of the human brain and its functioning, but we have a lot of new challenges to address, or remaining challenges to address. And the one that you mentioned already in the previous session is the challenge posed by the COVID-19 pandemic and the effect it has on the brain. But what we also want to do under Horizon Europe is to ensure that excellent research translates into concrete and innovative solutions for the patients, and that research must be informed by what matters most to patients and caregivers. So this is also an appeal to you to feed into the discussions, as John was also mentioning, under the Healthier Together EU Non-Communicable Disease Initiative. There's a stakeholder group where you can voice your interest, your ideas, and this will also help inform the research. And why am I saying that like that? It's because Horizon Europe, the development of the work program, will be done slightly differently than what's done on Horizon 2020. We are, and this is a favorite term used by my Director General, we are in a co-creation process, meaning that other Commission services work with us together to program what is important to be funded research-wise, for example, on the cluster health, which means that we have developed very good relationships with the colleagues from DG Santé, and John is a prime example, because we're working together for the cancer mission and the Beat Cancer Plan. But this means also by this co-creation process of the work programs under Horizon Europe, the public health needs that are addressed by the colleagues of DG Santé will be reflected in the priority for research. So definitely there's alignment between public health priorities in general, patient orientation and patient engagement, and the programming under Horizon Europe. Now, importantly, you know that we have been funding several initiatives bringing together research group across Europe. And we would like to, and I should mention the EU Joint Programme on Neurodegenerative Disease Research, GPND, or the ERADET Neuron, and the Human Brain Project. So these have so far been separate parallel initiatives, and we think it is important also to make best use of scarce resources and infrastructure to bring this in a new partnership, a brain partnership, so that we can further foster, on the one hand, this transdisciplinary collaboration, but also have an entry point for patients and stakeholders to voice their needs and priorities.
Thank you, Barbara. And that was my next question to you, was whether this sort of brain health partnership that many of our colleagues, like the European Brain Council, for example, are advocating for, was likely to happen. And I think you've addressed that. What I wanted to ask you then maybe instead is, could you give us some concrete ways in which you think this community could really feed in and help you shape those research priorities moving forward? And John, I'll ask you the same question from the public health perspective. You've both touched on this, but for those who are in the audience, if they want to get involved in this co-creation process, what maybe are the next steps, and what would you recommend that we do as a community to help you with that work?
I don't know if John wants to start, or should I start?
I don't mind. We have, for the non-communicable diseases initiative, which we announced yesterday and which I've copied details of in the chat, it's an open door policy. We're asking the member states to help us to define their priorities. We're asking the NGO, stakeholder, patient, health professional community to help us guide the writing of these approaches or the development of these approaches between now and June of next year, giving ourselves 6 months to bring these different ideas together. One thing is that it's actually innovative from several points of view. First of all, normally we deal with the member states and then afterwards the NGO separately. This time we're trying to bring them on the same page, which is complicated when you have 27 member states on one side and 350, 400 disease-specific groups on the other. So it's not an easy process, but I think actually the COVID cloud situation has improved the situation from our perspective, because we can now have discussions with people in the virtual setting, which are much, much easier to get people to participate in for an hour, for 2 hours. And we will be organizing follow-up sessions, with the member states and with stakeholder communities over the coming weeks and months, as I said, until June, so that there can be this contradictory discussion, I would say, between the different stakeholders to try and fix priorities in agreement. We don't want a long list of priorities. We want something that's much more focused and much more consensual, I would say, and reflects the fact that you do have comorbidities, for example, in non-communicable diseases, which are also a factor in themselves. And we need to have a look at the common determinants of health, for instance. You need to link in the research aspects, the pharma aspects, and everything else. So it's quite a complex exercise, but the fact that the WHO has done a lot of the thinking in advance is going to be very helpful.
Yeah, and that saves me asking you the next question around whether you think that could be aligned with the targets set out in the Global Action Plan. So I'll jump back to you then, Barbara, for your thoughts around those kind of specific ways the community can get involved.
In fact, there are several ways. So John presented the first way. Then secondly, what I would highlight is that there is the Conference on the Future of Europe, which has a stream of dialogue ongoing where citizens can voice their priorities in the field of health. So definitely you should, and I will paste the link in the chat, you should take the opportunity of that platform to voice your priorities. But then if we focus on research specifically, we have the annual Research and Innovation Days, where we discuss with stakeholders the priorities for the future. So this will take place in June, and you should take the opportunity to participate. Then, as you know, for Horizon Europe, we have a first strategic plan that goes until 24. But for the next strategic plan, 25-27, we will have, as was done for the first one, an open consultation process. So you should seize that opportunity to make your needs heard. And lastly, and importantly, in the approval of the work programs under Horizon Europe, the member states are involved and approve our work programs. So there's also an opportunity for you at national level to make your needs heard so that they are then reflected by the member state representative that is in our program committee. So these are a few avenues that you can walk and that I suggest you would take up.
Thank you, Barbara. There's a lot, I think, for us to consider there. And on that, I'm going to jump over now to Professor Thomas Berger, representing the European Academy of Neurology, one of the co-founders of the One Neurology initiative. Professor Berger, based on what you've heard in this panel, what you've heard throughout the meeting today, from your perspective, what do you really feel, we can do now, and what should we do now?
Yeah, thank you, Donna, and also thank you for giving me the opportunity on behalf of the EAN to share my thoughts, but also probably to deliver the one or other offer, but probably also request. It might be that some of my statements or answers to your questions are a mere reiteration what we already heard and also commitment we heard. But nevertheless, I think, as you said, as a co-founder of the One Neurology partnership, I think it's very essential for us to dig into detail and to wrap this up in this way as you asked me. So first of all, I think it's definitely clear that Europe is strong and a leader in neuroscience, and this position should be maintained. And we are also working on expanding this position. On this point, I would welcome a renewed focus that examines the support and cooperation to date with an intent of advancing the field, building on reducing fragmentation and building synergies between all the existing projects, initiatives and actions, a bit in response also what we heard before. Secondly, the translation research for neurological diagnosis, treatment and care needs a really true booster. There's a lot of work, but not enough concerted effort or joint effort, no impact analysis and no scale up. On this front, I would really highly welcome the Commission facilitation of coordination across the European Union. And herein, I also call the European Commission to tap into organizations such as the European Academy of Neurology and the One Neurology partnership. The EAN, I think, apart from several other commitments, but is very strongly committed also to educating the next generation of neurologists, leveraging interdisciplinary training, medical and health technology, and advances in neurology for the sake of our patients. And we do this together with EFNA, and this is the vital partner contributing to our efforts on medical guidelines development and also e-learning. And this, I think, unique and well-functioning partnership between the medical professionals and patient organizations houses valuable expertise, which we will gladly put at your disposal in the work related to the policy implementation roadmap and action proposal on neurological disorders. We are ready to share expertise by expert people with neurological disorders and expert neurologists. And furthermore, I think EAN and EFNA together as the One Neurology partnership welcome the recognition of neurological disorders as one of the major non-communicable diseases. I think this is a genuine, clear, self-explaining welcome. The partnership hopes to see this translated into an impetus that supports a range of public health measures at the EU member state levels to raise awareness on neurological disorders. And finally, I would like to end my answer to your question by stating that raising awareness in neurological disorders, the burden and the socio-economic impact, and an understanding that neurological disorders do have common risk factors, which we alluded several times already, common protective factors, what we alluded also several times already, and determinants is a crucial part of the puzzle that is missing. And OneNeurology, with the support of the European Commission and member states, of course, can bring this message to the forefront. And this is a first requirement for restructuring the necessary treatment and care of patients at primary, but also healthcare or even tertiary care settings led by the appropriately evidenced information. And I think this opportunity, this open door, as we also heard, is there. And I think we need to step in.
Thank you so much, Professor Berger. And I'm going to stay on the theme of the neurologists, but I'm going to move into the pediatric setting. And I'm going to ask Corinne to give your perspective in terms of what you've heard today on behalf of the European Pediatric Neurology Society.
Thank you very much that I can contribute to the meeting effective Pediatric Neurology Society. And of course, I'm extremely happy with this interest to make neurology a health priority, and across life is for pediatric neurologists a key word, because as you know, the brains of children from the fetal period until young adulthood continually change and develop. And this rapid and crucial brain development life to adults may be negatively influenced by genetic, environmental, psychosocial, and many acquired brain insults. And they may lead to more or less impaired neurocognitive and behavioral problems. And they sometimes only become apparent when the brain further develops, when children grow up. A child who is acquiring a brain damage at an early age, they may grow into the deficit only when they become. So effective treatment of, or if possible, prevention of pediatric neurological diseases and conditions will help develop them in brain healthy adults. I think this is important because the impact of these neurological diseases and conditions, the child's quality of life and participation is considerable, and the economic burden for the family and of society is present in childhood, but extends when these children become adults. And it's clear that a better integration of pediatric neurology with the life course and healthcare system create a chance of life and participation and a better disease management. I think that what is necessary is a better prevention, of course, of acquired brain damage. And think of the evident example of this is of brain trauma. But from the pediatric neurology perspective, also detection, and especially neonatal detection of treatable neurometabolic diseases, especially treatable when they are picked up very early, is very important. One may think of extending neonatal blood spot analysis programs, or even think about preconception consultations for rare and treatable neurologic diseases. Access is to promising new but also affordable therapies for rare diseases, such as gene-modifying therapies. And rare diseases taken together are not rare at all. One should think about that. And examples, of course, are spinal muscular atrophy type 1, progressive and lethal disease in infants, Pompe disease, or think about the treatments of Duchenne muscular dystrophy and treatment series types, which are now taking flight, are just starting. And these therapies are model treatment therapies for other childhood neurologic genetic diseases, and many more therapies are to be expected in the future. And investment in research efforts and funds for that is most important. One of the other things which are more basic and we should address is that there should be easy access to diagnosis and treatment and care. Easy access to well-trained pediatric neurologists can be difficult because the number of pediatric neurologists, maybe coming from neurology or pediatrics, or they have their own training scheduled, pediatric neurologists say, varies between European countries. So of the WHO family, they vary from 1 in 73,000 children from 0 to 18 years in the UK to 1 in 3,000 in Georgia, and everything between. So there's a huge variety in that. So we need high quality of training, and there's still a big difference between countries in duration and content of training. It varies very much. Therefore, I think important efforts have to be done to ensure the number and quality of pediatric neurologists in Europe. Have to ensure that they are available. And EPNS try to contribute to this by a high-level pediatric neurology training description in the EPNS pediatric training syllabus. The learning objectives are described. But there are also 3-year cycles of online teaching webinars and study material. European exam that will be held first time 2023. So I think access to pediatric neurology services, ensure that and ameliorate that for children here most important.
Thank you, Corinne. And I think it's been great to have you on the panel today, because very often, neurological disorders get put in that bucket of aging, and we think about some of the neurodegenerative conditions that are have been, I guess, prioritized in the past. But it's really important that we think about this across the life course and that we don't neglect certain demographics within the work that is happening. So I think it's been a timely reminder to have at the end of this meeting that we shouldn't forget those younger people living with neurological disorders as well. So in wrapping up this panel, because I realise we've only got 5 or so minutes left in our summit today, I'm going to hand over to Tadeusz Havrat, who I introduced as the Senior Advocacy Manager at EFNA. And Tad, we'd love to hear your thoughts on what you've heard today, I guess more from the perspective of those living with neurological disorders.
Thanks, Donna. So I'd like to start by acknowledging a tremendous progress that happened just this year, albeit this has been in a way forced by the pandemic. But we have now all eyes on public health, and we have an order of magnitude over 10-fold increase in the Commission health budget, even though, as we were just discussing, maybe the allocation of different funds can be still improved. And perhaps most importantly for us here, we have neurology entering, so to speak, a major league in terms of EU health priorities with this new EU NCD initiative and policy roadmap that promises to have a strong emphasis on implementation, but also on stakeholders' involvement. And thank you, John, for inviting us to provide feedback and ideas in shaping this program. So I'd like to just maybe add on what's been already said by others, including Professor Berger, in terms of some further ideas and recommendations. One thing is that the way forward, we know that there are some highly prevalent and already politically visible neurological disorders like Alzheimer or stroke, and they already have attention from EU policymakers. And while we certainly need to continue prioritizing them, I think that now it will be important to also look at neurology more widely and to have an inclusive approach that will provide this framework encompassing many other neurological disorders like Parkinson, migraines, multiple sclerosis, neurodevelopmental conditions like ADHD, to name just a few. And also, as Professor Bassetti mentioned in his opening talk, I think we need a truly integrated and cross-cutting approach across the whole of neurology. And what we have also seen in the last few years is that neurology was somewhat overshadowed by policies and actions addressing more typical mental health conditions like depression. And again, prioritizing mental health should certainly continue or actually even increase, but we want to make sure that neurological disorders are on equal footing with mental health and also with other major NCDs. And the last comment and recommendation I would have is that we have the global neurology framework. We'll work towards national frameworks, since the Global Action Plan main target is creating national neurological plans and policies. And between those global and national dimensions, I think that it will be really important to also have regional activities. And here, by regional, I mean European framework that could help EU countries to implement the global plan targets and also help translate the plan to European realities or contextualize and adapt it, as Dr. Tarun Dua from WHO said earlier. And in this context, we also heard at the beginning from MEP Montserrat that successful examples already do exist in other areas. For instance, the Commission provided templates for creating cancer and diabetes national strategies some years ago and helped with the overall coordination here. So we certainly hope that similar actions can now happen at the EU level around national neurological plans, which could connect the dots between the global plan, the EU for Health program, and also the new NCD initiative.
Thank you very much, Tadeusz. John and Barbara, I'd like to give you the floor each for literally 30 seconds if there's anything you want to add before we wrap up this panel discussion and conclude today's meeting. Well, John, do you want to go ahead first?
I'd just like to thank everybody for their ideas. I'd be very happy to look at the report of the discussion afterwards so I can pick them all up. The door is open, as I said, for your comments and your feedback on the development of this new idea we have on non-communicable diseases. And before I forget it, happy Christmas and a happy New Year to everybody online.
Thank you, John. Barbara.
Yes, just to add, I also invite you to engage, whether in terms of shaping the research agenda or implementing it. And I also wanted to assure you that we're really working hand in hand with the colleagues from DG Santé to make the most of our funding and ensure that research and innovation delivers for patients and citizens.
Thank you so much. Thanks to all of the panelists. At this point, I'm now going to play one last short patient testimony. This is from Bettina Hausmann, who is a person living with multiple sclerosis, and I think will provide us with a nice way to move us towards the end of our meeting. And after Bettina, you will meet Joka Jarsma, President of EFNA, the European Federation of Neurological Associations, who will say a couple of words. So for me, as John said, it's a happy Christmas and a happy new year to all. Let's hear from Bettina, and then Joka, it's over to you.
First, clearly neurological signs and symptoms were in the early 2000s, so 5 years before the official diagnosis. And at that time, I was affected and I sensed there was something wrong. And we also did have some neurological prehistory in my family. And I went to a neurologist and she just told me, you're stressed. So it took a while to really get to what it was. MS does, of course, affect your life. For me, if you talk about symptoms, then it is fatigue and multitasking that are the aspect of my life that are most affected, actually. If you talk about the broader picture, then so many things have changed, because
in the beginning, when I had just received the diagnosis, I had to try to just continue as if nothing had happened, which is probably the case for most people with MS. And from there, I realized more and more that this would not only be unwise, but also impossible. So slowly but surely, I adjusted my life to live quite well with MS. And right now, it feels totally all right. But when I think really about everything that I needed to adjust and that I had adjusted, it's pretty big. I think it's important to speak publicly about multiple sclerosis, but I do understand also that many people are not ready to do it, because it is a condition that is very, very widely misunderstood. And since very often you only see people who are in quite advanced stages, who have very aggressive forms of MS, because that's the only thing you can see, I experienced that many people who are either at an earlier stage of their condition or who have a milder form of MS, that they keep silent in order not to be labeled or feel as labeled. Yes, it's big, but it's not the end of your life. You can live with MS and you can do a lot of things. Of course, it's easier to say when you are, when there's many, many things you can do. But even for those people who have more restrictions, I think there is a lot you can do. And talking about it gives hope to, and perspective to others.
And hello, everybody. I'm very happy to say a few closing words today. It's been a long meeting, but first of all, bear with me for a few more minutes, because as this is the very first OneNeurology Summit, I would like to take you all back to the beginning of this journey which led to the summit. It was 2019 and the latest global burden of disease figures had just been published. We all saw them in the opening address by Claudio Bassetti, and we knew it was time for action. So mid-2019, a small team of EFNA and EBC staff decided to talk to the World Health Organization. And we visited both offices, Copenhagen and headquarters, Geneva, to discuss more attention for neurological disorders. That same year, more visits, talks and meetings with all stakeholders from a multitude of organizations and around the world followed in rapid succession. Then came 2020 and we organized a brainstorming meeting in Brussels, February, with a large group of key stakeholders around the table. And participants quickly recognized the need to come together and speak in one voice. We concluded the critical opportunity for neurology for the neurology community was there to unite and build an integrated response. The OneNeurology idea was born there, and very quickly we were delighted to join forces with the European Academy, and we effectively started the OneNeurology campaign in March of this year. Meanwhile, COVID was among us, and it impacted healthcare in ways that we could never have imagined. As also mentioned by several speakers today, we now know that this was highly relevant for neurology, and we also now know that if we are to get healthcare service delivery back on track, neurological disorders must be prioritized, since they are the most frequent, most disabling and most costly of all NCDs. As Dr. Barroso said today, the burden is absolutely overwhelming. Then, late in 2020, we addressed the United Nations General Assembly. And I remember saying there how pleased we were that mental and neurological disorders had, at that time 2 years ago, been added to the priority list of NCDs, an absolute recognition of the increasing and enormous burden of these diseases and a long due decision. But at that same meeting, I also had to conclude that still we had not seen neurology explicitly integrated into initiatives and actions in the areas of NCDs. That is not as systematically as we would like. There was much work to be done. And so we soldiered on. Today, the OneNeurology Summit is the result of much hard work since then. And as we heard from today's speakers, from this wide range of organizations, there has been much progress. The Commission's policy implementation roadmap, as recently announced and discussed today, is one great example. So it is so encouraging and reassuring to see that within a relatively short period of time, major change can happen. That implementation now is a buzzword, and that the patient voice has been an integral and generally recognized part in all of that. There are unequaled opportunities ahead, so let us exploit them going forward and work towards developing these concrete solutions. Together, as Professor Berger just stressed, solutions that can make a difference to the millions of people living with these often devastating disorders. The workforce theme is there, and the most needed serious investments and focus on prevention strategies, modifiable risk factors, when and where possible. The voice of the European patient, as so eloquently voiced by Russell Patton, once again reinforced the absolute need to really and very urgently address neurology and make change happen. I want to thank our speakers today for the inspirational talks. I want to thank our panelists and of course the teams that took such excellent care in preparing today's summit. And here I want and need to say one last and important thing. After today's meeting, Donna Walsh will leave the AFNA team. So today was truly the last time we have seen her in action for AFNA. Many of you have met Donna over the years, and it is for that reason that I want to mention also specifically today her important contribution to advocacy in the neurology space, and in particular the growth and development of the OneNeurology campaign. Thank you so much, dear Donna. The team at AFNA will continue in the same vein, and I am much looking forward to the exciting developments that will be there in the coming year. With that, may I also wish you a very happy holiday period, and I hope to see all of you while collaborating next year. Thank you very much.